Hey everyone, welcome to the Psyched to Practice podcast, your one stop for practical and useful clinical information, masterful insights from experts in the field, and a guide to daily living. I'm your host, Ray Christner, and with me,
Paul Wagner.
So, Paul, today is kind of a new endeavor for us in that we're now being able to offer continuing education credits for those practitioners out there who are listening. And we're going to start with the topic of grief.
Yeah. And I think it's a good topic really because it's something that can be so applicable. And, throughout our lives, everyone experiences grief in some way, shape, or form. And so, being able to, offer something that hopefully has some universal applicability to our listeners and hopefully able to, get them a CE credit. It's a win-win.
That's right. A win-win. And yeah, I think I'm glad you mentioned the point about everyone going through it at some point in life. And I mean, I think when we talk about grief, oftentimes we tie that to possibly death. And, I think grief can come in a lot of different ways. And, we're probably maybe going to lean a little bit on the relationship to death and dying. But we also have grief with things like maybe we move and there's a grief process, or losing a job or whatever, or, parents that have gone through a divorce and there's a grief process maybe for kids. So I think it's important to realize that grief can happen for a lot of different reasons. And because we all go through it, it doesn't necessarily mean that it's a mental health condition. And I think that's an important thing to recognize.
Yeah. And I think, so often we can really kind of make this comparison of depression. And, don't get me wrong, there's a lot of overlap there, especially if we're looking at the symptomology, but really the experience of grief and, how it's linked to these reminders of whether it's the deceased, undesired changes. And actually, I wanted to even throw in when you were talking earlier about those different pieces, even things that just didn't happen, like lost opportunities and grieving what could have been. And I was planning this and now things got upended. And so when there's these undesired change and it's really tied and kind of integrally linked with that, where when we are talking about depression, it has this more kind of persistent and pervasive quality to it. And we see it really kind of being established in a longer form, where when we're thinking of grief is intense, but grief isn't the only experience that's occurring for those individuals. Mm.
Yeah, I think that, again, we kind of tie this to depression. And I think I've given this story when we've talked about this topic in other forums, but, it's, several years ago, my grandmother died, and, the day she lived, 4 hours away from where I lived. So we kind of knew this was going to happen at some point. And when we got the news that morning, I actually had a doctor's appointment. So it just happened to have a physical, it was not out of the ordinary. And so, we got the news, talked to my family and said, hey, we'll be in this evening. But I figured, okay, I might as well just get my day going. So I go to the doctor, and loved my family doctor at that time. Great guy. And he was like, and I said, hey, yeah, I'm going to be out of town. This happened. He's like, well, hey, just in case, would you think you'd, want me to write you a script for Prozac just in case? And I'm like, no, I'm okay. My grandmother was, in her late 90s. She lived a wonderful life, and sad, grieving, but no, I don't think there's a clinical reason. And that was a real wake up call for me, because I thought okay, wow, here we have clinicians and healthcare professionals who see the tie of grief and depression being this link. And not saying that can't happen. I mean, we've seen those individuals in therapy, but I think it's an assumption that we make that there's something wrong with the sadness that comes with grief. And for me, I wanted to be sad at that moment.
Yeah.
It was the right thing for me. And I wanted to process that emotion. And, and I'm not afraid of my emotions. I mean, I think that's an important piece of it. So we do have to differentiate it, and we have to kind of say, okay, yeah, you might be down for a little while. And that's not necessarily meaning you're in a depressive episode. It is that thought and experience of loss that's there. So, yeah, I think clinically we can't jump to that. We have to be very cautious of that it's not depression. And even people who have depression going through grief doesn't mean they're having a depressive episode.
And, so often, like if I'm working with individuals that are experiencing that loss, and I'm maybe jumping a little bit ahead in something I'd like for us to make sure we're attending to even more fully. But I think off the bat, it's important to kind of recognize, like, I think more than anything, grief allows us to assign significance. And like, if we don't allow ourselves to have that experience and the intensity and the discomfort of those emotions, we can really recognize the significance of that loss, whether it's an individual, opportunity, movement, relationship, whatever that may be. And, it's been a few weeks, but there's a conversation that comes to mind where, working with a kiddo, and we're talking about, he's really pushing back. And even like, initially at the beginning of the session, we just bring up the word grief, and there's like this reaction in a sense. And, we're going through and we're talking about it and kind of going into it. And one of the things that really kind of caught him off guard, and I think really kind of built this buy-in to allow for the discomfort, was like, for me, like if I'm thinking about my losses and my experience of grief, I see it as significance. Like I don't want to think of that person and not feel this way. Like it almost feels like it does a disservice to that relationship. And I don't want that to be the only emotion, but I want there to be a significance there. And significance often isn't just assigned to the happy, positive emotion. Significance is like depth. And I think grief allows for that depth.
Yeah, I agree. And I think, the other thing I would kind of point out with this is, there's a lot of overlapping symptoms. I mean, I think, so someone going through grief may have things, appetite disruption or sleep issues that might come up. They may have low energy. They may be fatigued. And that's just all part of it, and I think when we're differentiating, it's easy to look at the symptoms. So if we go down the DSM checklist, it's like, oh yeah, they meet all of these criteria. But I think the part of going, what creates that emotional experience? And, so, with depression, even in those of us that are into cognitive therapy, there are days that we can't recognize the link or the thought that might be tied to that, or maybe the thought process is much more global. And in grief, it's very specific to that situation. So, maybe they're not sleeping because they're having dreams about someone who died or whatever that undesired change in their life was. There's a real direct link with the emotions and the thought process and the kind of, reliving the experiences with that person that are coming up. So, when we're differentiating it, so even if we have someone who has depression, and I, have had many, individuals that I've worked with who I saw for depression, and then there was loss along the way. And that's how we differentiated it. If you're having those significant emotions because you're sitting and you're in the thought about that person or that loss, and it's triggering those emotions, that doesn't mean we're necessarily going into a grief or a depressive episode. It's just part of our grief cycle.
Yeah. And the other side of that, like I guess where they don't overlap, that ability to experience positivity and that ability to really kind of form those other connections within our reality, so to speak. And so, where depression does have this pervasive kind of like almost undercurrent for us, grief is that targeted piece. And when we're there, it's intense, but when we're not, we can experience connection, we can experience joy. And I think that's an important marker to look out for as well. What are the other emotions experienced when we're not attending to that loss?
And maybe even in grief, there's times that we have positive and negative emotions
Absolutely.
simultaneously.
Yeah.
It's a recent experience in my life was my father-in-law, and I remember being sad and that kind of just the heavy emotion, but also loving hearing stories about him, and and laughing and crying almost at the same time, which so I think that's another piece that we got to really pay attention to. Yeah, we'll have positive emotions, and it's important that we tell people it's okay to roll with the emotions, that there's you don't have to be sad the whole time, and you can have those good memories, and it might you may go through, 3 or 4 experiences in a minute where it's happy, sad, and all of those. That's okay. I mean, I think, and normalizing the idea that, we're going to have a mix of emotions that will happen.
And I think we can even want the experience while experiencing grief. Like, I'm thinking some individuals I've worked with where, they're going through a separation out of a relationship that was a longstanding relationship. And all in all, the separations, they view it as a positive thing.
Sure.
And yet they're grieving the change. And,
Sure.
They're not, when they're saying that, like, it's not that I want it back, but it's significant. It's something that, and I'm recognizing that significance. So I can actively be wanting this to be happening, the change to be going on, but the experience of loss of what that change represents, that's the there's the grief there of like kind of the stability or the consistency that offered. Yeah,
I think that's a great example. I mean, when you said that, it cued me to, I have a young guy that I'm working with whose parents are divorcing. And in some ways, he's actually, I don't say happy about it, but there's a positive piece to it. Separated, his parents are both better when they're separated than when they're together. The conflict has decreased, but he's grieving the change, and he'll say, he's like, how can I be sad about it, but also know, wow, this is like my relationship with each parent's better now because they're not so stressed out. So I'm glad you brought it up with, I think, those kind of like divorce, I think is one where, we'll see those positive and negatives kind of simultaneously.
And I think that's why it's so important to think of grief as like an individual experience and an expression. And there can be variations even for the individual. And it's something that I think can often be informed, culturally or societally. And so we have to kind of recognize as clinicians, like there's these, 2, potentially even 3 different, like, maybe they're all aligned or maybe they're conflicting roles. If there's a strong emotion, but, almost an expectation of stoicism, or, if there's an expectation of emotional, like, outpouring, but I'm at a loss, or, the emotion I have is relief, I might not feel like I can express that. And so, making sure that we're really tailoring our experience and our support of the individuals we're working with to their experience of grief. And we can't, I think grief is, while we're saying grief is universal, grief is also very individual. And so it's a universally experienced individual experience. And,
Wow. That was a complex sentence. It's no, I think we do, the idea of understanding, and learning about their culture. I mean, I've had people that I've seen where, part of our discussion about grief is to really understand what their family's process is, or their cultural, I've worked with, Jewish families that they sit Shiva for 7 days, and what that process is like for them. And, that's not something that in my life I experienced, but hearing that process and the respect and reverence that brings in the process. And that's what, when you said that, it reminded me of that, where, there was, this staying home, we're caring for ourselves, keeping our thoughts with, the person who had died, and just such a powerful cultural process. And then, I think I probably going to say it wrong, but the 12-month process, I think RIAS-2 is how it's said, something maybe close to that, where then, at that 12-month mark, it's that idea of, kind of celebrating the person. And it's kind of like an anniversary that we recognize. That may be very different for somebody who's agnostic.
Absolutely.
But understanding that, I think, is really, and not assuming. I mean, I think sitting down and just listening. I've had patients who are Catholic. I happen to be Catholic. Their family's process is different than mine. I had a gentleman a few years ago who is Latinx, and his family are Catholic, but there's a lot of cultural pieces were very different. So I think we have to ask and that we shouldn't have expectations of a person's reaction in grief.
Yeah.
It's where, we may have somebody who they don't cry. They don't. And that's part of their personality. And I think there's an assumption that can get made that we're not grieving if we don't. And, that's definitely not the case. I mean, we're all going to do it a certain way. I've had, people who said, oh my gosh, I thought I would be really upset, and I'm not. I'm sad, but like I haven't cried. And everybody's telling them, oh, you have to cry it out. You have to cry it out. And they're like, no, like I'm sad of the loss, but the time was right for this to happen. And there was an acceptance, which we're going to talk about a little bit later, but they accepted it where the emotional level wasn't necessarily high, but it's a misconception to think they're grieving. And I'm going to say grieving wrong, because I think that's what we expect people to grieve a certain way. We have to think about that different.
And I think one of the most valuable things that we can then, offer in the therapy setting is really working to bring this kind of I think the first part is self-awareness to grief, to the emotional expression that it is. And, through that, working to normalize the grieving process. And, I think there's a variety of ways of doing both of those, but, especially, for self-awareness, like when we note difference, one, recognizing the change. And so if it's a death, that one can be pretty apparent. But so for some of those other ones that maybe we don't put as much significance on, culturally, if it is a lost job or something like that, like that's going to have a huge impact, but we might not think of that as, oh, I'm grieving the loss of this, or I'm grieving the loss of stability. I'm grieving, again, this change that's occurring. And so really working to identify with them, like, what are these changes that we're noting in terms of again, this strong attachment to the change itself, and building this ability to kind of be self-aware. And so whether we're promoting mindfulness, if it's journaling, even just kind of sitting and being, really working to be more self-aware and self-reflecting. I think that, we're going to do our clients a service by encouraging that time, them taking that time so they can grieve rather than it maybe being something that it's just kind of brushed over.
Yeah. And I like the idea, using the term self-awareness. It's what I use often with people, because, we're being aware of multiple aspects of our life. So, we kind of highlighted emotions here in this kind of first part of this, but we might have people that have a thought process that's involved in their grieving that could be intense, where, journaling can be really kind of helpful. But there's also a self-awareness of our behaviors.
Yeah.
Are they becoming maybe a little self-destructive afterward, or maybe they change their behavioral patterns completely. I've had people who, stop hanging out with their friends, and they, so this idea of self-awareness, we really need to, I think, as we're working with individuals, getting them to be aware not only of the emotional piece, but what are the thoughts that go through? What are your worries about the change and what that might bring? And also monitoring, how are we acting different? Socially, are we eating different? Are we, maybe if we're somebody who would exercise, were not. All of those factors are, I think, part of that self-awareness piece and important to address. And then that gets us, kind of back to what we had, said before. Everybody's going to do it differently. I don't know that there's a normal way to grieve. I think that, there's ranges that we all kind of fall into. So that self-awareness is a great technique to get people to find out what is their process. And,
I think I mentioned this individual earlier, but the one who was really resistant to even the word grief. And, I noticed that when it was first brought up that they'd experienced a loss, and parents were kind of telling me about there's a struggle with talking about grief and reactivity, there was this kind of outburst in the office. And one of the first things, parents kind of left and like kind of processing, I was like, it's like, what was that about? I'm like, oh, well, like this thing was annoying me. Like, okay, like I get, that thing traditionally annoys you. It hasn't annoyed you to the point where that's been the reaction. And to me, I'm thinking that this is related. And so again, just bringing that, reflecting and there was an acknowledgement, like, you're probably right. Didn't want to say, yes, that is what's going on, but at least kind of acknowledging and recognizing there's this change in my behavior. So I think knowing our clients well lets us be better at self-reflect, or helping them self-reflect, and even maybe pointing out things that we're noting or hearing differences in those reactions there.
Yeah, it's a great point. I think that it's, being able to really just kind of highlight what we're seeing or what we're hearing, and then letting them really kind of connect the dots, I think is, again, kind of a helpful process. So.
And, I think going into like that with the self-awareness piece, and like when we can build off of that, how we can then really work to normalize it. And there's not a normal way of experiencing grief, but grief is, because it's, again, I think a universal experience, something that we can really be empathic with. And so being able to share, if an individual's sharing about a time that they've experienced loss, I don't know the individuals that they've lost, or I don't know the opportunities that they've lost. I know the individuals I've lost. I know the individual or the experiences that I've lost. And while certainly they're not the same, we can, I think, apply some of that empathy. And in doing so, bringing awareness to, this process being a normal experience, and almost inviting it in a healthy way that can say, like, really recognize. So I think empathy in this moment is such a valuable tool, and being able to share a sense of understanding without saying, oh, I know what it is that you're experiencing, but I don't know what it is to lose that person, but I know what it's like to experience loss. And so I can connect with you on that level. And I think that ends up being a really valuable tool there for the individuals we're working with.
Yeah. I mean, I think or a therapist's empathy is, there's just such a valuable piece that brings to, not only grief. I think a lot of areas, but it also, I think by doing that, it lets people be in the grief a little bit. And, I find that it's, in therapy, we're trying to decrease symptoms, right? We're trying to, and my belief, and I think there's, some research that would kind of support this as well, is this is not one of those things that we're trying to necessarily take away. We're trying to be empathetic and understand, and to be honest, to have people stay in it for a little bit and not rush through it, and be okay with the fact that they have these emotions and they have these thoughts. There's this, and, when we, had our time on the Hey Kiddo podcast, we, kind of hit on some of this, but, we oftentimes hear people say, it's okay, you're going to move on. And, even something as simple as those words have a, really difficult kind of, I think, interpretations. I oftentimes will tell people, in time, you're going to move forward, but we're probably not going to move on. I don't know that, and I think moving forward's different. The loss that we have does carry with us. I brought up my grandmother at the beginning of the show here, and, she died in 2009. I still know the day that she died. I still on that day am a bit heavy-hearted and I have that piece, I have moved forward. Like I don't live in that space, but I carry part of that with me. And I think the idea of moving forward does have, I think, a better connotation. Something I oftentimes talk about with people is, yes, you don't have to rush through and all of a sudden be, okay, I'm going to get back on into life. Yeah, you're going to move forward. You're going to do what you need to do. And some of this is going to stick with you for a little bit, and that's okay.
And yeah, I forget the individual that, and it may have been a training or a class, but they brought up the idea of grief doesn't shrink. We just grow around it. And that's I like that idea comment. Because it's always there. And even the idea of it shrinking kind of means like, oh, it's going to go away, or, we're not going to recognize it. But if we're wanting to, we can go and steep ourselves in it. And I don't know that that's always a bad thing, but there's so much more room that we can also explore that isn't that. And that's the growth that we can experience when we're grieving or after grieving. Right.
And I think, these ideas or these techniques of having people be self-aware and us being empathetic and, creating a safe space for them to be in and discuss their, the grief process they're going through. I think that's how we help people move forward with it and kind of let it grow around them. We're not trying to take it away. It's an okay process to go through. And I don't really necessarily have research to support this, but I have found with individuals I've worked with, when we take that approach, that process of moving forward seems to happen faster when we let them be there, when we let them be in it. And I say, listen, it's okay. Like, feel that way. Let yourself be there and experience the emotions. It's not that they get stuck there. It's just they need time to process it. And we will see that, over time, we'll see them kind of go, okay, like, yeah, it's still with me, but my life's getting to what my new normal is going to be.
And if you think, like, if we have a major surgery, we don't go into physical therapy the next day.
Right.
We need the time to be able to recover before we can start then putting in the effort to renormalize and like regaining some of that footing.
Yeah.
And we'll still have the scar, but it will then be a scar and it won't be as painful.
Yeah, that's great. It's a great kind of analogy for that. So,
and, I think when we're talking about this, like, grief can be such a nebulous thing that I think at times, especially earlier on when I would work with individuals in my career, like, I was overwhelmed and I didn't really quite know, like, is this grief or is it not? And, in doing preparation for this episode, there are assessments out there, like assessment tools that I do think are, do have value and do have a place, because while grief isn't, there's no normal grief, there are markers for grief that we can recognize. And so, there are tools like the Inventory for Complicated Grief, or the ICG, the Prolonged Grief Disorder Scale, the PGD, as well as other tools such as Grief Experience Questionnaire, or the Texas Revised Inventory for Grief. And, I think that these are important pieces that can kind of quantify or give us a bit more like that, more specific data. And I think this is a really important thing for things like research on grief, because we need a way for it to be, reliable and valid when we're talking about the symptoms. I do think that individual experience is also a piece of it. And, I'm thinking back to a pull on the episode quite often, but with Michael Alsey, and he talks about, we as clinicians are both scientists and artists. And, we need to kind of marry some of that research with also the art of therapy.
Yeah, I think it's a key. And, I would say I don't believe that everybody we see with grief, we need a standardized measure to use. I find them useful for people who are trying to understand their grief a little better, and where, it maybe goes back into that psychoeducation a little bit, right? Where it's like they're trying to understand where they're at. And while we can get a lot of that through a clinical interview, sometimes that objective kind of measure to go through and answer these kind of true and false or Likert scale type measures, it gets them thinking. And I don't use them often, but when I have, it's, I always ask people afterward, so what was that like? Like to kind of go through all of those kind of items that are kind of different aspects of grief. And, I think the part that's really helpful is I've had many people who will say, things like, gosh, I've been doing this for the last month and I didn't realize it was tied to my grief. I was, making it an assumption it was something else. So it's a great way, I don't think we need tools to say someone's grieving or not, but tools to understand it and then to utilize those, not just from, hey, you have a score here, you're grieving, but to have a discussion with the person and help provide a good psychoeducation about their grieving process. That's where I think those tools have incredible therapeutic value. But the art of it comes back to our clinical interview.
Yeah. And, talking about like that, those objective measures, I know that there are models out there, and actually there's, I think, some very popularized ones. And I think that, some pros and cons to the models. I think the one that I was most familiar with was the Kubler-Ross, talking about the 5 stages. And so we have denial, anger, bargaining, depression, and acceptance. Actually, again, a little bit later on in my career, being exposed to the warden's tasks of mourning, so that acceptance of the reality of the loss, process the pain, adjust to a world without the deceased, and find an enduring connection. And, I think both of these aim at really working to identify, like, where's the point of this process that I'm in? And I think it's a worthwhile effort, but, I'm doing a lot of callbacks, but I believe our episode with Sandy and Brian on treatment planning, I think it was Brian who said phases, not stages. And I think especially when we're talking about grief is such a fluid experience. I think he said we can go through 3 different emotional experiences within a minute. And so to think about, I'm in one static stage, I think is challenging. So I actually like to draw it almost like as a 5 different points on my whiteboard. And we talk about, hey, you could be here and then jumping around and identifying, like, what are the ones that tend to fall off a little quicker? What are the ones that kind of hang out a little bit more? And, I think that helps to kind of normalize that it's not just this, we go through each stage and then we're at our acceptance point, or, we're at our connection point, but rather how we can kind of ebb and flow throughout these phases of grief.
Yeah. And I like I love the term phase definitely better than stage, because the more I get in my career, I find there's less stages that really happen. We really do kind of, and I think the piece I like about it is that, again, kind of tying all this back into the kind of, how do we educate individuals? I talk with people and say, we may go through these, Kubler-Ross stages and say, yeah, okay, you had this anger stage that, kind of happened after, and we've kind of gone through and we moved through that process. And maybe that person's even in this phase of acceptance at the point that we're having this conversation. But it's a great point for me to say, you know what, this is kind of like skiing, right? Like, it's when we're really good at skiing, we can slalom down the hill pretty well. And, we're going back and forth and it's really simple. But when it becomes too difficult, we start snow plowing to stop the same way we did when we were starting. And these grief phases kind of work the same way. We may be at a point of acceptance, and then the stress in our lives go up, and all of a sudden we're snapping and our anger comes back. And, when we process it, they'll go, oh my gosh, like this brought up this thing with, my father passing away or whatever it might be. So when we understand these phases and the fact that developmentally yes, it gets easier, but yeah, we might fall back sometimes, and we might even get that depression piece. We may even bargain again at some point in that process. you don't have to go through them, one after the other.
Not a linear process by any means.
Not a linear process. It's what a kind of a reference I'll bring up. It's an old school reference. Probably some people have read it, but one of the books that I actually think's really interesting about grief is When Bad Things Happen to Good People. Harold Kuchner, he's a rabbi, wrote the book many years ago. And there is some religious kind of pieces to it, but it's not necessarily just kind of ideas of Jewish religion. It really is good for really, I think, anyone, and even people who wouldn't be, who have no religious affiliation. But that book, I think he does a really good job of kind of talking about Kubler-Ross's work in a way that's not stage specific. So something that if you haven't read, I think it was published in maybe early 80s. It's a pretty old resource, still relevant today. Great book to look at.
And, as we're talking, and especially with bringing up, Kubler-Ross and really that phase or stage of acceptance, I oftentimes find myself when I'm, working with clients, I really want to kind of sit in that idea of acceptance and talking about what does it actually mean? So we're sitting there, I'm saying acceptance. I try to ask them when I'm saying that word acceptance in this context, what does it mean for you? And often I don't even know, and it's I'm good with what's going on. I'm okay, let's step back. Do you think you're ever going to be good with, the loss of a loved one or, this lost opportunity? And are we really setting that up as a realistic expectation, or going back? And this is kind of when I was talking about what grief does for us in creating significance, I think it also helps us kind of creating significance or meaning in circumstances. And so trying to challenge that more of I'm willfully wanting this to happen, and versus I'm recognizing it has happened. And I'm also then working to recognize the significance of what that transition means. And I think in doing that it allows us to, kind of maybe make new narratives for ourselves of okay, if this defined me previously, what now defines me? Or, if this individual was my role model, how do I then still kind of bring them into my life in a different way? And so, many conversations with individuals where we talk about anxiety triggers, just kind of thoughts of when my loved one passed away and I'm viewing them there on their deathbed. And that is such a hard moment. And yet if we can think about also the grieving process and that ability to make meaning and significance, we're bringing them into this present moment. So, they're living a life beyond that life, and, they're now here influencing your thoughts, and you're able to then carry them into this new circumstance. And so really trying to help redefine some of those pieces of what acceptance means. And I think it can be also a very culturally, significant piece. We're thinking about religion, or we're thinking about, beliefs about the afterlife, or even beliefs about why things happen. We can work to place significance and work to make meaning.
Yeah. Yeah. And it's, I think the idea of the acceptance piece specifically, it's, there's that kind of two-pronged kind of aspect. It is the acknowledgement of what's happened, and we know it happened, but it really is kind of, again, I keep using the word sitting with, but it's really bringing it into our reality and letting ourselves truly process what happened. But the other piece that you really talked up is that how do we integrate it in the rest of our life? And, so acknowledgement and integration are really key aspects of acceptance, and it's, we said it earlier, it's not this moving on. It's not that piece of it. It's, how do we bring it into our life? And I used a word similar to what you do. I tell people, it's, their life carries on with us. There's pieces that everybody, and when we're not talking about death, I even say experiences. I think we've all heard somebody say, "Oh, I wouldn't change my life, even the bad things that happened in it," because we're all, I think, shaped by them when we do accept them. Maybe we didn't get into the college that we wanted to get into. That could be a grief piece. but maybe the college we went to, we connected with a professor that, let us, do different things and pushed us to a different level. And while we were grieving the fact that we didn't get into the ideal school, there's that part that because of it, it actually helped us kind of move forward. We accepted the fact that didn't happen, and we took advantage and moved forward with the opportunity that was presented to us. So we can do that, I think, with a lot of aspects.
And I think to that, like one of the things that I think I do it both actively and passively, but this is actually something I try not to actively name, but rather passively encourage and build recognition of it for themselves, is like recognizing resilience and like, how we are resilient in the experience of grief, going throughout the process of it. And, in doing so, how we're able to, again, moving forward is resilience, recognizing it, this hard moment is a moment. That's resilience, not getting to that college you wanted and persisting further. It wasn't a stopping point. And, one of the things I like to talk about, use a lot of metaphors, is, if we're in a maze, even if we take a wrong turn, that's still progress. That's still us moving forward. Really, the only way we don't is if we stop. Like eventually, if we take every wrong turn we can, we'll find our way out of a maze. But we need to be able to have that persistence and the resilience when we hit a dead end. All right, how do I view this as, helpful information and a helpful experience rather than feeling defeated? And I think if we can work to empower our clients or those individuals we work with to foster that resilience, I think we're doing them a good service.
Oh yeah, and I always, the word resilience is always kind of a mixed thing for me because it got so popular. It was like we actually everything was resiliency, but the root of that term is so meaningful because I think sometimes we forget how resilient we are just naturally as human beings, and that at the end of the day we have this capacity to do it. I mean, kids are the greatest example. They amaze me. Like I see kids overcome difficulties, especially at a young age. They don't even think about not finding ways around them. So yeah, resiliency is, I think, a great piece when we're talking about this idea of grief. And maybe it's not something we really have to teach people. We just have to make sure they're aware that part of who they are. We all have it. And sometimes we forget it. And sometimes we, get into a sense of going, how am I going to get through this? And at the end of the day, we do. And I love your metaphor because maybe we're driving a road that looks like, twists and turns and off ramps and roadblocks.
Yeah. And I think one of the important distinctions in talking about grief and even like that resiliency isn't resignation. And acceptance isn't resignation. It's not something where we are just kind of like passive and it's like, well, it is what it is. And like, I think it is what it is such a important, and also like I have a love-hate relationship with that right. statement because like, yes, but also no. Like if we're allowing it to be, it is what it is. And so I'm stopping. What's the point? That's the resignation. And that's the piece I think, again, as the clinicians, we need to be aware of and looking out for, because if we just hear that statement, we're not kind of questioning further, well, what does that mean for you then? Well, like, what's the point? Okay, well, like, let's maybe push and, try to explore that a bit more. But it's like, hey, it is what it is. Like, it's not going to change. I got to do something different. Okay. Yeah. No, there's some resiliency. We're creating movement. We're creating change for those individuals and helping to foster that. Yeah.
And I actually, I'm with you. The is what it is kind of is, again, one of those words for me. I'm like, are those phrases? But I tend to move people past that terminology. I actually will say, let's just acknowledge that what happened. It is what it is, because it is an experience that we've had, and let's just stay there right now. And again, acknowledge it, accept it, and then take a second and go, okay, now what? we have to figure the next, again, back to your metaphor, we hit a roadblock. What's the next turn that we're going to take that's going to help us through this? And it, in some ways, not only resiliency, I think it creates a problem solving for people, where it's, I've had people who go, I don't know what I'm going to do. Like, I relied on this person for all of these things, and I'm stuck. And go, okay, this is a problem solving process. This has happened. This is where you're at right now in your life. And what are the things that we can start going through? And I'm not saying that we do this week one after somebody's grieving, but it could be throughout a year's process that things are happening that they're trying to get through. But yeah, I think, we do have to get that. It is an experience that we have to acknowledge and then move on or move forward on it.
And I love that you brought up the problem solving piece, because I think, again, that's an area where we as clinicians can really flex our muscles a bit. That's what we're there for, is to help, in someone with problem solving in a sense. And so how can we work to sit with them? And I think, there's so many different, even therapeutic modalities out there, cognitive therapy, huge influence with problem solving, being able to attend to these thoughts, and, whether it's in reframing or restructuring thoughts, or even, taking different approaches, working to experience exposure, like all of those different pieces, it allows us to have problem solving. Really, another great one I think that is very applicable here is acceptance and commitment therapy. With that ability to kind of blend the mindfulness, the behavior strategies, and like really working to have that, like, okay, how do I accept my grief while still working to be, committed to what my resolve is, whether that's based on my values or my goals. And yeah, it doesn't let us doesn't let us stop fully at that roadblock. We're stopping. We can get angry. We can sit in our car for a while and be really frustrated with the construction or whatever that may be. But it helps us kind of make that U-turn and, find the new path.
Yeah. And I think, you mentioned two things there, the ACT piece of it, the mindfulness piece. I'm going to throw the CBT piece in the kind of basket here as well. And I think when we're talking about kind of research and why are these techniques useful with grief, it's because they both have two components that we've repeated probably 10 times here. Be present, be right in the moment. That, let's stay here for a little bit. Let's sit with it. And then the what's next, and what is, maybe what's next is just going to take a week off and do nothing because that's what I need. And maybe what's next is I want to get back to work because that gives me a routine that I like. And again, no right or wrong answers, but all of these, or those three, really, I think when we look at research on it, why are they beneficial? And it goes back to those components. We're not trying to, solve every aspect of it. We're trying to just help people. What's the next step that you feel that you're in the moment to take, and addressing, again, we talk about emotional or self-awareness and thought awareness and behavioral awareness. All of those aspects all kind of fit in with these. So the research, I think, is pretty consistent that they work, but I'll say that they're not the only ones. I mean, I think there's, I think ones that I'm probably not as experienced in is, the different types of narrative therapies and expressive therapies. I know there is some research around art therapy being very effective, both children and adults. My stick figures don't work well in that in the world of art therapy. I mean, I think that, again, it's those modalities of therapy. They can possibly not effective, but if we're using them in the same way, again, hitting those key pieces that we've talked about throughout this episode, any of those therapies can also bring a great value.
And when we're talking about this, like, promoting resilience, like, encouraging our clients to meet their own needs, through that, what's next. I think also really working to inform the psychoeducation piece, like, what are the barriers? Like, what are those things that it's going to make it hard for us to be able to experience what's next? And like, there's so many different pieces with grief, but I think two of the more common ones are like, when we feel guilty over the loss, whatever that loss may be. And, it's maybe even kind of like there's some cognitive distortions occurring with that guilt, encouraging some of that reframing and, hey, are we magnifying and minimizing here what's going on? And, I like to encourage, like, I want you to feel guilt, but I want it to be a helpful or productive guilt. Like, if it's all or nothing guilt, oftentimes that's just not going to be effective for us. And, it can then also then lead to that anger, it's maybe not a fuel in the best direction. Whether it's anger at, especially anger at ourselves, and, the Kubler-Ross, anger is a part of the process. It's a phase, but also recognizing, while it can be a great tool to help promote change, it can also be one that if we don't allow it to promote change, it can turn into resentment. And I think resentment then kind of keeps us stuck.
Yeah, I think those, addressing those barriers are absolutely necessary. And, with the idea of anger and guilt, it's, really trying to get to, you talk about restructuring, but really understanding where are those thoughts coming from. That's, maybe they're not angry at the person, the deceased. Maybe they're angry at God. Maybe they're angry at whatever. Maybe the guilt is, man, the last conversation I had with this person was X, Y, or Z. So it really is trying to utilize those cognitive strategies to get where that thought starts with people. Because it's not often, like I find with anger and with guilt, it's not related necessarily to the death itself. It's usually something that happened earlier. Gosh, like, I wasn't around for the last year because I just kept working too much. And, so the days that they said, hey, why don't you join me for dinner? I said, I got to work late. And there's that regret that kind of happens. So making sure that we're using those techniques to get kind of the root of that, I think, is important. I want to bring up one last piece as we're kind of wrapping up here too, is, we didn't really necessarily at this point talk about the fact that, the recent edition of DSM-5 TR, we now have grief in there as, guess we're going to call it a diagnosis. I'm not sure. I love the term that grief is a diagnosis, but really specifically, DSM has talked about prolonged grief. So, much of what we've talked about so far are strategies to deal with grief, I think, more in the immediate time frame. And I'm saying immediate 12 months. Maybe the first 2 months. But when we're talking about prolonged grief, we're talking about really those significant and maybe at times severe kind of still reactions that happen over a long period of time. And while some of these same strategies can be helpful, I think we have to also acknowledge there are some people doing things like short-term dynamic therapy that when we're seeing prolonged grief, that type of an approach might have a greater impact for people. Again, it really just depends on the person. But I think in the short term, where we see these therapies under the cognitive behavioral umbrella being helpful, when we start talking about prolonged grief, that there may be some other options where we need to explore as well.
And, it's such an important piece because, like, grief as a diagnosis, I think I'm in the same boat as you, where I like the idea of a diagnosis being like a common group of symptoms that we can identify and work to, like, distinguish and giving someone a name for something. But when we're taking it on as that label and labeling something that truly is a universal experience, it does feel like there's a concern there. And I think a piece of that is how well we know our clients. And, so again, even going back to, like, back to, one of our other episodes, that actually we're going to be offering as for CE credits, the case conceptualization, like, when we're doing that, the clinical interview, when we're kind of gathering that information, like understanding what are some of the fundamental aspects that are, crucial in this impairment, and being able to then offer support, and so if it is a prolonged grief, how does that differ then from how we're treating a depression diagnosis and vice versa?
Yeah. And I wish we could, maybe this is an episode down the line, but I wish we had more time to really talk about, when we're saying like this idea of maybe not agreeing with the diagnosis of grief, I'm going to go back to it's a normal process.
Yeah.
And that's my concern. But I will throw a reference to people. So because we may not get to that for a while, I encourage people to read Alan Francis's book, Saving Normal. And so for those who don't know Alan Francis, he was the head of the DSM-4 committee, who during DSM-5 resigned his position because he was not in agreement with the fact of pathologizing what he saw as normal behavior and normal experiences. And his book is, I think, really great. And so for those that wonder, maybe, hey, why are they kind of saying that they're questioning the idea of diagnosis? Not questioning that there are people that go through prolonged grief, but it's a very delicate idea of pathologizing normal experience. And so I'll defer to Alan Francis for those interested in kind of digging in that a little deeper, and maybe we'll tackle it down in another episode.
Well, and, with this being one of our first episodes that we are working to offer CEUs with, we're still in process. And so, if you're listening to this episode at drop, I don't want to promise that the exact link is going to be up, but please check out our social, because, if you're listening to this, you're like, oh yeah, no, I went to the trial, I want some credit for it. Check out our website, being able to sign up for that, and then being able to register for the course. And then, we have kind of after listening, if you're interested, you will be able to go and register for the course, and then, getting a quiz about the information that we discussed here, after, successfully passing. Would that be the term we want to use there? Like after passing. And then after passing the exam there, being able to receive that credit. So we're really excited to be able to offer this. We're really, we're going to be offering even more. So please go check out the website. And again, if you go and you look and it doesn't look like it's quite up, our social media will be blowing up when it is available, and, circle back around and make sure you get credit. Yeah.
And our hope is these credits will be easy. So listening to our episodes is the course, and all you have to do for a 1 hour episode is take a 8-question quiz based on the content, and it's that easy.
Yeah, you've already done
and then
the work.
You get 1 credit. Yeah. So we're excited about this. I think it's a great opportunity for those who do listen to take it a step further for themselves.
Well, and with that, we hope you enjoy this episode. We'll be back in 2 weeks. But until then, be well, stay psyched. The information contained in this podcast and on the Psyched to Practice website is intended for informational and educational purposes only. Nothing in this podcast or on the website is intended to be a substitute for professional, psychological, psychiatric, educational, or medical advice, diagnosis, or treatment. Please note that no professional patient relationship is formed here, and similarly, no supervisory or consultative relationship is formed between the host, guests, and listeners of this podcast. If you need the qualified advice of a mental health professional or practitioner, please contact services in your area. Similarly, if you need supervision on clinical matters, please locate a supervisor with experience to fit your professional needs.